All right, the humerus. So this is the only bone in the arm. And remember, the arm is not the entire upper extremity. The arm is only going from your shoulder joint to your elbow joint. So this is the one bone that you're gonna find in the brachial area or the arm. And so the humerus, it's gonna have this nice rounded head, and we already saw where that articulates with the scapula at the glenoid cavity or glenoid fossa. So you know that this is always gonna be the proximal end. And then the distal end, it's gonna have these bumps and projections at the bottom. So that's to just kind of generally orient yourself proximal versus distal. Now there's a bunch of different structures you need to know on the humerus, and these are gonna be really important for different attachments of muscles that we're gonna learn in the shoulder and arm. So first thing, this here, this nice smooth rounded area at the proximal end, this is gonna be your head. So this is the head of the humerus here. Now just under the head, you're typically gonna have a neck and long bones. And so you can see there's this kind of faint groove here. That is your anatomical neck. And so it goes around the base of the head like this, versus you have something called the surgical neck, which goes around here like this. So anatomical neck is right under the head, surgical neck goes around here. So kind of in between the proximal end and the shaft, surgical neck here. Now in between those, you have a couple different structures. So notice here, you have a bump here and a bigger bump over here. So this is actually an anterior view, which we'll go over. But from the anterior view, notice you can see the little bump and you can see part of the big bump. Now if I flip it and we look at the back or posterior view, you can only see this bigger bump. You can't see the smaller bump. So that's really helpful for orientation. Now these bumps are called the tubercles. So you have a greater and a lesser tubercle. So the lesser tubercle is gonna be this small little bump here, and the greater tubercle is this bigger bump. So remember, from the front, you can see greater and lesser tubercles, but from the posterior view, you can only see the greater tubercle. Now you can see in between these two bumps, you have this nice little indentation here. This is called your intertubercular groove or intertubercular sulcus. So in between, the tubercles. So intertubercular groove or sulcus here. And this is an important area because the long head of the biceps brachii is gonna travel up through here. Because it houses the long head of the biceps tendon, it's also called the bicipital groove in some books. So you may see that when you're looking these up. So greater tubercle, lesser tubercle, intertubercular groove or sulcus, also called the bicipital groove. Now keep these bumps in mind because these are going to be really important for your rotator cuff muscles. So a nice easy way to remember the attachments of the rotator cuff muscles is if you hold the head of the humerus like this. So notice my thumb is on the lesser tubercle, and then fingers 2 through 4 are all on the greater tubercle here. So you can hold it like this. And this is just a nice, easy way to remember the attachment of the rotator cuff muscles. So we'll go over these when we do shoulder, but for now, kind of a preview. The rotator cuff muscles, you have SITS, S-I-T-S. So you have supraspinatus, infraspinatus, teres minor, and subscapularis. And if you put your fingers like this, the first 3 are your S, I, and T. Those attach to the greater tubercle. And then your last S, your subscapularis, attaches to the lesser tubercle. So just a nice little trick. So S-I-T-S, rotator cuff muscles. And then right in between the tubercles, that's the long head of the biceps in the bicipital groove. All right, moving a little bit more inferiorly down the shaft. So here, this isn't the most obvious thing, but this kind of roughened area on the lateral side of the shaft here, this is your deltoid tuberosity. And that is the common attachment for the anterior, middle, and posterior parts of the deltoid. They all sit up here and they come together and they all insert on the deltoid tuberosity as one. So that's this nice roughened area here. Adjacent to that, you have this kind of faint This is just a bone clone, it's not a real bone, so it's kind of hard to see, but you have this faint groove. This is called your radial groove, and it's formed by the radial nerve and the deep brachial artery, because they travel right against the bone here. And so they create this really little like faint groove. And remember, the radial nerve is coming off the posterior cord of the brachial plexus, and then it's going to be posterior, so back here, and then it's wrapping around posterior and laterally, coming around towards the anterior side here. So as it's doing this here, it's creating that nice little groove. And this, for osteology purposes, the actual groove is not that important for you to be able to identify on the bone, but it's a really important concept for you to understand, because the radial nerve, because of its close proximity here, if you have a mid-shaft fracture of the humerus, you're gonna affect that radial nerve. So just be aware that the radial nerve does travel against the bone here, and it does create a groove. So that's all the structures on the proximal humerus here. So we've got head, anatomical neck, surgical neck, greater tubercle, lesser tubercle, intertubercular groove, deltoid tuberosity, and then radial groove. Moving inferiorly or distally to the distal portion of the humerus, you're going to have these two grooves or ridges coming off the shaft, where the shaft is widening up to form the distal end. So here, this one is going to be your supracondylar ridge, here and here. So this one is going to be your lateral supracondylar ridge, and this one is going to be your medial supracondylar ridge. And it really depends on the book. I think some books call it the supraepicondylar ridge, but either way, you have a lateral and a medial here. Now you know that this is medial because if you look back at the head is always going to be medial because that's attaching with the scapula here, right? So you have, we're still on the medial side. You have the medial ridge and the lateral ridge here. Now, if I'm saying supracondylar or supraepicondylar, you know that these are going to be things above either epicondyles or condyles. So the next thing that I want to point out are the epicondyles. Now, epi means above. So these are going to be above your condyles, and they're going to be bumps. So here, you have a bump here. This is your lateral epicondyle, and this bigger one is going to be your medial epicondyle. And because, again, these are epi, they're going to be above the condyles. So the condyles are actually these things here. And these have more specific names. So this nice rounded one here, this is your lateral condyle, but the more specific name is your capitulum. So this, it's nice and round, and this is going to be where the head of the radius articulates. This one over here, the kind of like bow tie shaped one, this is your trochlea, or your medial condyle. So you have medial and lateral condyles, medial and lateral epicondyles, and then the medial and lateral epicondylar ridges. Now there's a couple more little fossae. So remember, a fossa is like a scooped out area of bone. So you have this little fossa right here, this little fossa right here. This little fossa is going to be your radial fossa, this one right here. And that's because, like I said, the head of the radius is going to articulate there. So here's a radius, and if I put the head on there, now if I'm flexing the elbow like this, notice that this part of the radius just dipped right into there when it's going around the capitulum. So the head of the radius comes in and it dips into this bone, which is why you have to have that little divot so that you can produce elbow flexion. Now this one here, this one is above the trochlea. Now the trochlea attaches with the trochlear notch of the ulna. So if I grab an ulna, put this here, there's a projection of the ulna that actually dips into that bone, similar to the radius. So this area here is going to be your coronoid, this area here is going to be your coronoid fossa. And that's because this little bump on your ulna is the coronoid process. So they're named similar. So radial fossa, coronoid fossa, capitulum, trochlea. Now, if we flip it, this is a posterior view. So remember, the bigger bump here is gonna be your medial epicondyle, and this one's gonna be your lateral epicondyle. So just to keep orientation. But notice in the back, you have this big bump, or not a bump, you have this big kind of indentation here. This indentation, if you look at an ulna, is gonna articulate with this process here. And this is called the olecranon process of the ulna. And when you put them together, this articulates with the olecranon fossa of the humerus. So once you learn the forearm bones with the arm bone, hopefully it'll make more sense and it'll be easier to remember. But on the posterior part, you just have the one fossa. This is your olecranon fossa. On the front, you have two. So you have the coronoid fossa and the radial fossa. And then the very last structure that you need to know is on your medial epicondyle, which is this big bump, you're gonna have this groove here. So this groove is the groove for the ulnar nerve, or the ulnar groove. And this is really important to understand. Again, the actual structure on the bone is not that significant, but understanding where that nerve travels is very significant. So the ulnar nerve